Hi, good afternoon, and I hope it's not too late to wish everyone a Selamat Hari Raya. So welcome to yet another Facebook Live brought to you by Cvskl in collaboration with Viatrice. So I'm Dr. Al Fazir, and I'm a consultant cardiologist in Cvskl and has been in this field for the last, 15 to 17 years in interventional cardiology. So I think we have a interesting chit-chat session to talk about the heart or any particular questions you have regarding the heart. So I think my topic today is about, I'm here to share about various exercises that we can do to treat your heart. Okay, so let me show you some slides that I've done earlier. Okay, so today is about, the topic today is take 5 in your daily routine and what activities that fuel the heart. And this is Cvskl in KL Sentral. So I think the main thing we'll discuss today is exercise, and a lot of patients ask what kind of exercise is good for me, how much exercise is good, and when is exercise bad for you. Okay, so in general, when we talk about exercise, we talk about aerobic exercise in the sense that you get about 150 minutes per week of moderate intensity aerobic activity, or 75% per week of vigorous aerobic activity, or combination of both, and preferably spread throughout the week. So that is at least, if you can do more, it's much better. So roughly about half an hour to 1 hour a day of aerobic exercise. The common question that people will ask us is, what is my heart rate? How intense should I do for my exercise? So basically, if you look at your target heart rate and how you calculate your target heart rate is you look at your 220 minus your age. So say that if you are 220, if you are like 40 years old, then your target heart rate is 180, for example, and then you calculate from the 180. What is your maximum zone, your anaerobic zone, your moderate zone, your light zone, and your warm-up zone? So I think nowadays, we are very familiar with having heart rate monitoring watch. I think it's very important. So when I cycle, we'll use either a watch or a strap to see what is our heart rate that when we do the exercise. So say that if you're 40 years old and your maximum heart rate is 180, then you want to go to try to start with light heart rate, say like maybe you're 108, 110, and then you try to maintain your heart rate about moderate intensity. And the moderate intensity is about 70 to 80%. And the whole point of your moderate heart rate is to improve your fitness, your endurance, and your power. And intermittently, when you want to push yourself, so that means you can go either hard or even maximum, which is like 90 to 100%. And when do you, you can go to sort of anaerobic or maximum zone for only a few minutes, maybe 5 to 10 minutes. And then you come back to your moderate zone as well. So I think we all try to keep our exercise between 60% to 80% majority of the time. And then at times you want to push yourself, you want to go up the hills, you want to accelerate, then you go into your anaerobic or your maximum zone. So if you look at here, a different chart here, when you look at your heart zone or your moderate zone is when you can talk to your colleague when you're cycling, but slightly uncomfortable. But when you're really pushing yourself, that's when you find that it's very difficult to have a conversation. So that's when you know you are in the red zone. The benefit of being in the red zone is that you can go faster, so you can cycle faster when you go up the hill, or you can jog or run a bit faster. And however, you can only do this in a short duration. So when we mention short duration, we tend to say about 5 to 10 minutes. And then majority of your time will be in the moderate zone. So again, if you calculate your heart rate of 220 minus your age, and you take 60 to 80%. So like for me, I'll try to keep my heart rate about 130 to 150 majority of the time. and there are times when you want to accelerate, then you go to like 160, 170 for a few minutes, and then you come back down again. Okay, so that's how fast and how vigorous we do for our exertion. Yeah, so maybe later on, if we have any question and answers, Q&A session, then we can discuss a little bit more in this topic. So we do a lot of endurance cycling. So we have actually cycled around, well, part of Sabah before, a few years ago, and we did about 130 to 150 kilometers per day. So I think cycling, you can do endurance, but I think one very important part of when you do this kind of endurance ride is make sure that you have enough recovery and also enough sort of diet and food supplement, electrolytes. So very important to have all the sort of the electrolytes and all the equipment you have. This was a group of us that went into Dolomite. So this was a place in Italy, a mountainous area, and if you enjoy cycling, the Giro d'Italia is currently in this part of the world. They're doing the cycling tour, so yeah, very fun. So I think doing endurance sports is to me is very exciting. It takes away a bit of from not just doing work, and then you get healthier and you meet new friends and get fitter and get healthier. That's our point. So when you talk about exercise, we have about aerobic, which is the endurance, and then you have about the resistance training as well. So one thing that I've not done enough is probably need to do a bit more strength work. So I do a lot of maybe tennis and cycling and swimming, which I enjoy. However, I think we also need to make sure that you have resistance training or strength work, and that is like push up or sit up, bars, and dumbbells and so forth, or going to the gym. For this one, it does help to reduce fat and create a leaner muscle mass. And of course, the last part of your exercise would be stretching, flexibility, and balance. And I think this is very important because number one, it allows you to perform better when you do your exercise, your endurance exercise. And number two, it also prevents you from getting any injuries or damage. So the whole point of doing an exercise, or if you go and compete in events, you need to ensure that you don't get any injuries, because once you get injured, then it will take time to recover. So that's the number one. I think exercise is very important. So I was trying to think about 5 things as well. We're talking about take 5. So I was trying to think about what else is important. And I think the food selection is very important when you do exercise. Typically, when we cycle or we're going to do a long distance bicycle ride, we will probably go for a complex carbohydrate a day before. But I think the important part of dieting or being healthy, maybe in my mind anyways, is about having low sugar diet. So low sugar diet is very important because there is excess of sugar probably in our daily consumption. So I have been personally on myself on the last 2 weeks of low sugar diet. This was probably after the Raya makan. So I have been on black coffee every day. And yeah, not much things to eat. So the problem with low sugar diet is that you will realize that when you go and have look in your fridge at night, there's really nothing to eat. Everything is really sugar based. So it's quite difficult for me, but I do feel healthier. I feel less tired, better mood as well. So I think I feel that we consume too much sugar, and this is my agenda for my own health, is to have a low sugar diet. And I think also for the Ramadan month, when we were fasting for 1 month, I do intend to maintain and do intermittent fasting. And I think all of this, importantly, is like, you do burn excess fats, and you optimize your consumption of energy, and paradoxically, you actually feel better, and you don't get so tired. So I think what you consume is very important. And what I've learned by doing a low sugar diet or being aware of sugar is that when you start thinking about sugar, you realize that actually nearly everything you consume contain an amount of sugar. So I was telling my patients, and because they will say what kind of fruits can we eat. So even in fruits, they have got different amounts of sugar in fruits. So I was a bit shocked because I used to have mango every night after dinner. And mango, I do know that you have this sachet for coffee. And one sachet of coffee is like 5 grams of sugar, the one that you put in your coffee. And when you have a mango, that contains 50 grams of sugar. So that's like 9 sachets. So that's quite a lot. So the fruits that are very good is like guava, even actually strawberries, blueberries are quite good. Grapefruit. So I think even fruits that you take, you have to be careful. One of my patients asked me, how about dates or kurma? Because we have dates a lot when we are fasting. But the difference in having dates is that you don't consume 30 dates in one go, or you don't consume 50 dates in one go. You have 1 or 2 dates because you know it's sugar, because you know it gives you the energy, you consume one. But the problem with food is that sometimes you don't know what you're consuming, and you may not realize that what you're consuming, even fruits, may contain more sugar than your typical Coca-Cola. Okay. The other slides, about 2 more slides anyways. Number 1 is, of course, rest and recovery. So that's very important. Well, those who like to do Ironman or triathlon, there's Langkawi is just announced they're going to do one soon in November. And so people are starting to train, and because I'm not good at running, or I don't run very much. So they were saying that you do 3 kilometers or 5 kilometers first and gradually build up. And why you can't do 20 kilometers straight away is because you want to have to prevent injuries. So you make sure that every time when you run or when you cycle long distance, you must make sure that you have adequate rest and recovery. The 4th one is general health checkup, and I think this is very important. I had last few days ago, one of my cycling partners came to see me, and he's very fit. He cycles much faster than I do. He's 50 years old, very lean. He's going for the Desaru Ironman next month. But when we discuss a bit further and you do a general checkup, you realize that he's got a bit of hypertension. He's got a bit of high cholesterol. And when he did the stress test, there were some changes. So for him, because he's going to do a high endurance sport, we decided to do a CT cardiac. And in CT cardiac, we found he's got 30%. So, well, it's not severe. There was no significant blockage, but at least now he knows that although you can do marathons and all that, doesn't mean that you don't have any blockage, or doesn't mean that your blood pressure is normal, doesn't mean that your cholesterol levels are normal. If you've seen him, he's very fit, but it's because of his genetic, his family history, that his cholesterol levels were high. So he had to, and his lifestyle is really good. So we had to put him on some medication to address his high cholesterol and his high blood pressure. But otherwise, he's well. I told him enjoy his Desaru Ironman in July. He should be fine. My last slide here will be manage stress and be happy. And this is very important because, I mean, we have many stories and anecdotes of what's happening to this world. Everyone's a bit stressed at work. We also have, we know our colleagues, cyclist friends who even had heart attack while cycling. So I think number 1 is, of course, make sure you do your exercise, you have a good diet, have a good rest, manage, do your health checkup so that at least you know where you stand in, whether how's your cholesterol, your blood pressure, and everything else. Manage your stress and be happy. Well, okay, so this is some of the slides, some of my pictures of my friends in the world of cardiology. So this is what we do as a cardiologist. It's your heart, this is your blood vessels, and you got a valve in your heart. So when you come and see a cardiologist, we'll come and address and make sure that your heart is healthy. So that's very important to make sure that you have a healthy heart. And for us, in CBS and some of our colleagues as well, we also travel around the region. So I'm just happy that the world has opened up. And so one of those sayings is that if you do what you love, hopefully you will never work a day in your life. And of course, not being stressed from my side is we do enjoy our work and our friendship. So we've been, this is in Sapporo, our friend. This was me helping a case in Kedah. This was when my attachment in America, Washington, D.C. This is everywhere. So this was in Belfast with our Indonesian colleagues, Japan and Brunei. So, okay, so basically that is my top 5 tips to maintain a healthy heart. Let's see whether we have any questions. Exit full screen. Okay, let's look here. Questions from audience. Okay, let me see. So I have 5 questions for now. Nighttime is good for exercise or daytime is good benefit for our body? Okay, well, it depends. I think number one is how's your commitment for work. Daytime is good, especially in the morning because you get vitamin D. And it's very surprising that if you check the vitamin D in Malaysia, majority has got vitamin D deficiency in Malaysia. And I think because we go to the car, from the car to the office, and then we come back in the evening or night time. So if you do your exercise in the morning, number one is very cooling. And number two, you do get your dose of vitamin D, which is very important. However, not everybody has the luxury. So to me, any exercise is good enough. So some will do at night. Some prefer to do at night because it's cooler. So I think any form of exercise, whether it's day or nighttime, to me is fine. What supplement, question number 2, can I take to strengthen my heart? I'm a heart patient, 51 years old. Okay. So when I read this question about supplements, I think number one, we need to get our basics right before we go to supplements. So when we say basic right, because I have patients who have got high cholesterol and hypertension, and they're talking about, doctor, what vitamin is good for me, or can I take this? And they will come with a shopping bag full of 10 vitamins, which I've never seen before. And they're spending so much money. But if you look at the cholesterol level, you look at their blood pressure, it's so bad. So number one, very important, supplement remains a supplement. So if you control your basics right, you get your BP under control, the cholesterol, your sleep, you get 6 to 8 hours of sleep right, you manage your stress, then we can talk about supplements. Generally, supplements are the supplements. So there has not been really any supplement to show that it changes the outcome. Some feels a bit healthier or stronger. And it depends. I mean, if you have enough vitamin D, you don't need supplements. Some patients who are vegetarian, they might not have enough certain nutrients. So if you are deficient in certain nutrients, multivitamins is an option. But if you have a good diet, you'll be more than enough. I've got my uncle in Malacca who takes raw garlic, and he is 101 years old now. So there are definitely diet is very important. So I think if you go to diet and have a healthy diet, and to me now, I am into my low sugar phase of dieting. So I would do that. So supplements, I don't take any supplements myself. I think if you have a good and healthy diet, that would be enough. Okay. Number 3. So many questions already. Is daily aspirin still a good way to prevent heart attack? Okay, so aspirin is a good way, and if you have a heart disease or you have a heart attack or you've had coronary artery disease, yes, aspirin or blood thinners do help to prevent a heart attack. because it prevents the blood from clotting and blocking your blood flow. However, we don't advise everyone and anyone to take aspirin because there's also a small risk of bleeding. Okay, so you can bleed, well, although the risk is small, but it can happen. So I think in anything, it's a risk and benefit. So if you somebody who has got a heart attack, diabetic, then we'll advise them to be on a blood thinner like aspirin or other forms like Plavix, clopidogrel. Number 4. Hi, doctor. My question is, how do we watch our sugar intake? Oh, this is my field for the last 2 weeks. Of course, you mentioned fruits contribute high level of sugar as well, correct? So number 1 is very frustrating. Very frustrating because majority of our food, if you go and Google, has got sugar content. So I've decided that I will have some sugar, okay? Because fruits have got fibers. So although it has got sugar, it's not a processed chemical sugar. It's got some amount of fibers and nutrients, so that is okay. But you have to realize that not all fruits is the same. It's not the same. Okay, so like I said, I have mangoes every night for the last 3 years. No wonder my BMI is not to target. So now I've decided to be more mindful. And what I like about having this sugar, maybe the word is sugar mindfulness, not sugar-free diet, is when you start looking at bread. Oh, bread has got 5 grams. Okay, potatoes got 10 grams. So I'm more mindful of what I have now. And when you're more mindful, sometimes you go to an event, a raya event, you have chocolate cookies or kuih lapis and all that. Okay, you can have it, but then you're mindful. Okay, I've had my sugar for today, and you. But before this, because you're not mindful and because you don't literally see the sugar in your diet, you are not aware. So I think the key is to be aware. The amount of sugar that you have or that you will consume is easily available online, so you can check how many grams and how many grams. So like my wife, I told her to buy for me Weetabix, bagel, We'll see how long this lasts, but there's 2 weeks now. Black coffee, no sugar in the morning. I love it. Okay, number 5. I was given a clean bill of health with no cholesterol in my heart, but aneurysm is possible. What potential signs might show up? And what medical checks are there to be absolutely certain? Wow. Okay, so I don't know where this question comes from. But number 1 is good. So let's just go through one by one. Clean bill of health and no cholesterol in my heart. Well, the only way to know for sure whether you don't have any cholesterol in your heart is probably a CT scan, because you can do a stress test. You can't really tell whether there's any cholesterol plaque. But if you do a CT, then you might be able to see there's no plaque built up in your heart. But aneurysm is possible. So aneurysm, what aneurysm means is that the heart or the blood vessels is a bit enlarged. And so I'm not sure whether we are talking about aneurysm of your heart or aneurysm of your other arteries in your body. If we talk about the coronary arteries, and sometimes we do see this when we say, okay, your blood vessels are good, no blockage, maybe from an angiogram or a CT scan, but your vessels are a bit enlarged. It happens. We see this more commonly in smokers and some patients who have diabetes, and maybe some of them have got congenital. They are born with some form of infection that causes this inflammation, maybe like Kawasaki disease and all that. So, what potential sign might show up? Usually, if it's an aneurysm, it will be. You won't notice anything because it's not going to cause any issues. But what can happen is that some patients who've got large aneurysm, the blood flow in your coronary arteries or in your aorta become turbulent. So when there's turbulent flow, there is a risk that you might have clots forming. So in some patients who has got aneurysmal coronary arteries, or we might give them blood thinner like aspirin to prevent a blood clot. So I had a patient, he came from Bangladesh and he did his angiogram in Bangkok. I think it was one of the Bangkok Bumrungrad hospital. He had aneurysm arteries, and he came to Cvskl because he wanted to check, because the last angiogram was 2010. Well, he's had a single antiplatelets, so we did a CT scan this time. It looked the same as before. So for him, we maintain as a single antiplatelet, control his cholesterol and his hypertension. So the way to know aneurysm, if you're talking about aneurysm, would probably be a CT scan. So that's what I did for him. Or sometimes we find an incidental aneurysm from an angiogram. Doctor, how about ketone or ketone diet advisable? Okay, so I actually Googled this up as well, because there's so many diet out there. There are, to me personally, I think the best diet is a Mediterranean diet, where it's more natural. You have your greens and probably a bit of fish. Ketone diet, and also sugar, because I think sugar is just a bad chemical that you have in your body that's excessive. Regarding ketone diet, where you go for no carbs, my only thing that I'm a bit uncomfortable with this is that you consume much more protein or steak or cholesterol and fat. So I'm not so comfortable with that. Although in the keto diets, you tend to lose weight much faster, but you can have a rebound in your increase in weight as well. So to me, what I'm trying to do now is just be more natural. So I think I just consume too much sugar, number one. And at some point, I'm going to reduce, be more mindful about my cholesterol. So I think the best diet I would still say is like Mediterranean, where it's more vegetables and some form of meat, fish, and your protein, but less fried stuff. So that's how I see it, because that looks more natural. Number 7. Number 7. Doctor, every day I like to drink 3-in-1 coffee. Black coffee, mixed condensed milk. Oh, do I get problem health? Oh, yes. So yeah, not good for you. So I think coffee is okay. Coffee's got caffeine, so do not drink so much. But 3-in-1 is not good, unfortunately. And like I say, sugar is bad. Condensed milk is bad. Condensed milk is another form of high density sugar, and because we're not aware and we drink it. So one day I had coffee, and my wife put a little bit of hazelnut or vanilla essence, and it felt very sweet. So, and last night I came back home at 10 o'clock after doing some slides like this. I had a salad with some tomato cherries, and I actually was surprised how sweet the cherries were. So when you reduce your sugar intake and you recalibrate your sugar intake, things become sweet naturally. So that is my experiment in sugar intake for the last 2 weeks, and I hope it lasts a bit longer. Okay, anything else? Okay, I've been given the sign to say all done. Okay, so I think before I wrap up with my last sentence for the day, I'd like to thank all of you for sharing me your questions and your time. And as we mentioned, that we will be giving out 3 heart screening vouchers in Cvskl to see one of us. And the winners are, you can see me. I'll talk more about sugar. So the winners are Zailian, Rosna, M. Ismail, and Gregory Pua. So congratulations, well done for joining the session. So before I sign out, my top 5 tips for everybody is exercise more frequently. Be mindful of your diet, because there are many things that we are not aware of or what we are consuming, even fruits and many other things. Number 3, have a good rest for your recovery. So take it easy, don't get any injuries. Number 4, health screening, very important, because we don't know where we are in the spectrum. And the last one is manage your stress and be happy. So thank you very much, and thank you to Cvskl for organizing this Facebook talk on Thursday evening. Thank you.